In bit-by-bit video, I'm going to talk about choroid plexus papillomas and also a little bit about atypical choroid plexus papillomas and choroid plexus carcinomas. Choroid plexus papillomas are intraventricular tumors, lobulated, cauliflower-like with intense enhancement, occurring in both children and adults. About 50% of choroid plexus papillomas occurs supratentorial, and the supratentorial location is more common in children. In adults, about 70% of choroid plexus papillomas occurs in the fourth ventricle. About 25% of choroid plexus papillomas have calcifications, and one of the presenting complaints is hydrocephalus because of overproduction of CSF, so not the obstruction of the ventricular system. On histology, choroid plexus papilloma has the same fibrovascular tissue that the normal choroid plexus has, but the choroid plexus papilloma is covered with this plastic thickened columnar epithelium. And you can see in this specimen the border between normal choroid and the choroid plexus papilloma. Choroid plexus papillomas are very vascular because of the fibrovascular stroma that the normal choroid plexus has as well. And this is a very old case from the 1960s where you can see very faintly a choroid plexus papilloma on angiography. And it was a good thing that they made a drawing next to the angiography, and you can see how this tumor is fed by the choroidal arteries. In the top differential diagnosis of an choroid plexus papilloma is an intraventricular meningioma that we discussed before. That's also a very vascular tumor. And there are also two entities that look like a choroid plexus papilloma and are radiologically indistinguishable. Choroid plexus papillomas are grade 1 tumors. Then there's an atypical choroid plexus papilloma that is a grade 2 tumor, and there's a choroid plexus carcinoma that is a WHO grade 3 tumor. It's good to know that choroid plexus carcinomas typically occur in patients under the age of 5, so in adults it's very unlikely that you have a choroid plexus carcinoma. All these entities can have leptomeningeal metastasis, so that does not differentiate. The vascularization of choroid plexus carcinomas is slightly higher than the vascularization of choroid plexus papillomas. And this was a nice article from the AJNR 2015 in the pediatric population, of course, because otherwise you wouldn't have to consider choroid plexus carcinoma. And the carcinomas had higher perfusion on dynamic susceptibility weighted images and on arterial spin labeling. And of course, in a pediatric population, arterial spin labeling is better because you don't need to give intravenous contrast. So the key to considering a choroid plexus papilloma is the cauliflower-like, intensely enhancing mass with hydrocephalus because of overproduction of CSF. And you can see in this patient that there's also a large fourth ventricle. And because of this overproduction of CSF, you get the symptoms. And in the next video, I will start focusing on how the CSF is formed and discuss the lymphatic systems.